Welcome to the deep dive.
Glad to be here.
Today we're getting into something called nasopharyngeal stenosis. It mainly affects cats.
Right. It's basically a narrowing or sometimes even a blockage way in the back of the nose near the throat.
Yeah, exactly. We've looked through a medical overview, sort of pulled out the key bits.
Our mission really is just to walk you through it, what it is, the causes, how vets spot it, and, what the options are.
To give you a clear picture.
Hopefully, yeah.
Okay, so the basics. Nasopharyngeal stenosis, it means this membrane, like a thin sheet of tissue, forms.
Uh-huh. And it narrows the opening between the main nasal cavity and the throat area, the 1A. Or sometimes it's a bit higher, above the soft palate.
And the scale of this narrowing is pretty striking, isn't it?
It really is. Normally that opening is maybe a centimeter or more across?
Yeah.
But with stenosis, it can shrink down to just 1 or 2 millimeters, sometimes even less.
Wow, such a tiny change, but a huge impact on breathing.
Definitely shows how delicate that whole system is.
So what causes this membrane to form? What are the triggers?
Well, chronic inflammation seems like a really big one.
Like from ongoing rhinitis, that inflammation inside the nose.
Exactly. Or sometimes chronic regurgitation or vomiting can irritate that area at the back of the throat.
Makes sense. Irritation leads to scarring, maybe.
Kind of like that, yeah. Scar tissue forming and tightening things up. There's also a possibility of congenital issues, meaning the cat's born with it.
Though maybe less common for this specific issue in cats.
Seems that way. The overview mentioned thickened muscles as a cause in dachshunds, actually, but yeah, less typical in cats.
Okay. And other irritants, like foreign bodies or maybe something related to anesthesia or acid reflux.
Yeah, those are possibilities too. Anything causing long-term irritation back there, basically.
So if a cat has this, what signs should people look out for?
The big one is difficulty breathing through the nose. Classic upper airway obstruction signs.
Like sounds, whistling or snoring when they're just breathing normally.
Uh-huh. And open mouth breathing, especially when they aren't hot or stressed out.
That's a key clue.
And interestingly, you often don't see a lot of nasal discharge, which is different from, say, a bad sinus infection.
Right, that helps differentiate it. These signs often drag on for months too, right?
Yeah, long term. And they might get worse when the cat tries to eat or drink.
And another big flag, standard treatments often don't work.
Exactly. You try antibiotics, maybe steroids, and nothing really changes. That makes you think something else is going on.
Like a physical blockage. And you might notice just less air moving through the nose or none at all.
Yeah, you can sometimes feel that if you put your hand near their nostrils.
So, diagnosis. How do vets actually pin this down?
Well, first step is ruling out other things, the differential diagnosis process.
Right. What else looks like this?
Things like nasopharyngeal polyps, those little growths, or chronic rhinitis. But again, you'd usually expect more snot with that. Could be a foreign object stuck back there, a tumor, maybe a fungal infection, even laryngeal disease, though that affects the voice box area more.
Gotcha. What about imaging? X-rays.
X-rays are often normal, surprisingly. They might not show that soft tissue membrane very well.
So maybe a CT scan?
Yeah, a CT scan, especially with certain views, can sometimes show the stenosis. But maybe the key diagnostic test is simpler.
Oh.
Trying to pass a really small, soft tube, like a 3.5 French catheter, through the nose down into the throat.
And if it stops?
If it can't pass through where it should, that's a strong indicator of a blockage, the stenosis.
And I guess direct visualization, looking back there.
Exactly. Using a tiny scope, like an endoscope, or sometimes even just a dental mirror under anesthesia, lets the vet see the narrowing directly.
Okay, so once it's confirmed, what can be done? Treatment.
The main approach seems to be something called balloon dilation.
So non-surgical.
Right. They insert a small, deflated balloon catheter to the narrowed spot and then inflate it gently.
To stretch it open.
Precisely. It physically widens the passage. But it might need to be done more than once.
Especially in dogs, the source noted, but maybe in cats too.
Yeah, recurrence can happen. For those cases, sometimes placing a stent like a little mesh tube can help keep the airway propped open long term.
And post-procedure, any meds?
Sometimes antibiotics are used, maybe some anti-inflammatory steroids for a bit, to help with healing and reduce inflammation.
And follow-up is important, I guess.
Definitely. Owners need to keep an eye on the cat's breathing, the nasal airflow, because, like we said, the stenosis can potentially come back.
Right. So to kind of wrap up the key points, nasopharyngeal stenosis is this physical narrowing at the back of the throat in cats.
Yep. often caused by chronic inflammation, maybe irritation, possibly congenital factors, leads to significant breathing problems.
Diagnosis involves ruling out other causes and often directly seeing or probing that narrowed area.
And treatments like balloon dilation offer a way to manage it, though sometimes repeats or stents are needed.
It really makes you think, doesn't it? How such a seemingly small physical change, that little membrane, can have such a dramatic effect on breathing.
It does. And it leads to a broader thought, maybe. What other subtle anatomical variations in animals or even in us might be causing significant health issues that we tend to overlook?
That's a fascinating question to ponder, something to definitely keep in mind.
For sure.
Well, thanks for exploring this deep dive with us today.